Well, good afternoon, everyone, and I'm honored to kick us off this afternoon with the Fast Four. And we've had a couple of exciting days with announcements that we've made, and I'd like to go over some of those now if I could. Governor Beshear and our administration are committed to bringing real opportunity to every corner of Kentucky. Over the last 2 days, we've announced some exciting projects that will do just that in my home of Eastern Kentucky. Thanks to the funding from the Appalachian Regional Commission, we awarded more than $6.6 million for 13 projects in 11 communities across the region of Eastern Kentucky. Funding went to projects in Greene County, McCreary County, Albany, Boonville, Hazard, Moorhead, Mount Vernon, Paintsville, Pikeville, Somerset, and Whitesburg. This grant will allow these projects support the very values as Kentuckians will use this money for critical infrastructure, create new educational opportunities and programs, health care, create good jobs, and better the lives of our Eastern Kentucky families. One of the ARC grants went to Moorhead State University, a place near and dear to my heart, for the aerospace program at the Space Science Center at Moorhead State University. This grant will allow them to install 12-meter satellite tracing antennas and update the Star Theater, which will expand education and outreach opportunities and cement their legacy of graduating qualified workforce-ready engineers and physicists throughout that program of the Space Science Center program. Projects in McCreary County, Albany, Boonville, and Whitesburg went to update water and sewer system improvements, which is so important to the entire region of Eastern Kentucky. The projects will ensure Kentuckians have clean drinking water, which is a basic human right, and will help industries expand in the region. Thanks to everyone who made these projects possible, and Governor, you always mention these folks that write these grants. And without those that dot every I and cross every T, these grants would not have a possibility to be reviewed and then awarded. And to all of our Kentucky communities, please stay tuned, because there's more to come as we continue to build that brighter and better Kentucky. The governor also announced several Kentucky transportation awards across Kentucky. In the last 2 days, we've also announced a dozen of funding awards to local governments, a total of nearly $13 million to 14 cities and 29 fiscal courts from the Kentucky Transportation Cabinet. In all cases, the awards are reimbursements for work performed on resurfacing, repair, and broken pavement and drainage ditching. In all cases, the roadways were rated in poor condition. Kentucky Transportation District engineers assess the road conditions to determine the most critical needs based on factors such as safety, economic impact, and traffic volumes. The funding reimburses these local governments for work they perform on roadways that were rated in poor condition and badly needed fixing, whether it was new pavement or breaks in road beds or drainage ditching. A total of 196 projects across Eastern Kentucky. Let me give you just a few examples. Going west to east, the city of Barlow, down on the Mississippi in Ballard County, was approved for $223,000 after resurfacing 11 city streets. Morton's Gap in Hopkins County will receive $16,370 for its single project of drainage ditching work on Shop Street. Nelson County will receive $267,800 for work on 3 county roads, such as resurfacing 2 miles of Plum Rum Road. Nicholas County will receive $379,332 for resurfacing parts of 4 roads, such as a 2-mile stretch of Miller Station Road. And in Johnson County, my next door neighbor and close to home, was approved for $332,827 for resurfacing on 7 local roads, including about 1.5 miles of the Middle Fork of Genesee Creek there in Johnson County. The point being, transportation infrastructure that improves people's lives isn't confined to the big projects like interstates and parkways and bridges over the Ohio River. It's equally as important to keep and maintain the streets and roads right around where we live. That's one way we build this better Kentucky. Some exciting economic development announcements as well. Yesterday, I attended another groundbreaking. The agri-tech company AppHarvest recently announced construction has begun on its 3rd high-tech greenhouse in Central Appalachia, this time in Beshear. The project stands to create 60 full-time jobs for the people of Beshear and that region and their families. The company will focus on growing leafy greens at a controlled environment indoor farm, which will span about 15 acres. The company continues to position itself for success within a developing agri-tech industry, and it demonstrates our potential to make Kentucky the agri-tech capital of the world. The announcement marks the 3rd great piece of news to come from AppHarvest in less than a week's time. Last Wednesday, AppHarvest celebrated the opening of its more than $100 million state-of-the-art high-tech mega greenhouse in Moorhead, Round County, Kentucky. It is a 60-acre facility and is expected to create over 300 jobs for families in eastern Kentucky. Last Tuesday, the day before, the company announced the ground has been broken just outside of Richmond, close to EKU's ag farm, on a greenhouse which is comparable in size to the one that we cut the ribbon on the next day in Moorhead. Last Tuesday, the company announced this groundbreaking in Richmond, along with the EKU officials, the president, and its local officials. An exciting time for Madison County, exciting time for Round County, and yes, there is more to come. Please stay tuned. All this activity tells us AppHarvest is going to be the economic driver in the Commonwealth for a very long time. I'm grateful to AppHarvest, in part to our state's growing agri-tech industry, and I appreciate the company's emphasis on furthering sustainability, economic vitality, and community development in Kentucky. I want to thank my good friend Jonathan Webb and everyone at the company for bringing those incredible opportunities to Kentucky. Also, good news for Harlan County. This morning, the county judge contacted me, and he is ready to announce a project that he's been working on there in Harlan County. UPS has given Harlan County a final thumbs up to announce the reopening of the facility in Harlan County. Due to the surge in e-commerce and to improve customer service in southeastern Kentucky, UPS is returning to Harlan County and will reopen the extended center at Baxter in November. This reopening will bring back 20 jobs that left the county in 2016. The company will also be creating an additional 40 jobs at this facility in the next few months. The distribution of packages from this facility will begin in November. UPS is planning on reopening the customer service portion of the center in February. We want to thank Wally Asher, UPS business manager, and County Judge Dan Mosley for working to return this operation to Harlan. We wish Shannon Hall, UPS operations delivery driver, supervisor as well, in opening and managing the new Harlan facility. Governor Beshear and I joined Harlan County Fiscal Court, Harlan County Economic Development Authority, and won Harlan County in welcoming UPS back to Harlan County and look forward to working with the corporation for years to come to grow and serve the citizens of our communities. As we go to the fourth part of the fast break, the fast at 4, of course, Mask Up Kentucky, but T.O. Jordan, I was reading some of the news outlets over the weekend, and this absolutely touched my heart. T.O. Jordan's a high school student at Holmes High School. He's been working at Kroger for a few weeks to help his family and also save for a car. He was working at that store and he saw a shopper who didn't have enough money for all the groceries that he had while he was checking out. Theo provided $35 of his own money to help him get all the food that he needed. I think that's what Kentucky is all about. This young man who stepped up, saw somebody in need on any day, but especially in the tough times of COVID and the hard times that some people are going through. This is what Kentucky's made of. This is who we are. Very moving story. If you didn't get a chance to read the story, I would encourage you to do so. The other encouragement and the other, I think, thing that's on everybody's mind a week from today is Election Day. Early voting is going on now. I would encourage all of you to get out and vote. It's your time to have your voice. It's your time to play your part. And when you go to vote, please wear your mask. Put your mask on. Let's whip this terrible virus across Kentucky and across and around the world. Put your mask on. Wash your hands. Social distance. Stay away from large crowds. Governor, it's been a good week so far. I'll turn it over to you. Thank you.
All right. Thank you to Rocky for some of the good news of the day. And thank you to the Grayson County Cougars, whose mask I am wearing today. We appreciate what they and every single one of our schools and their staff are doing to keep our kids safe. And today, a little bit later, we're going to be talking about our Red County recommendations again and how the timing of the actions for those communities can line up with the guidance we provided to schools so that an entire community can come together when a county goes red to get it out of being red as quickly as possible. Can you bring up our stair-stepper chart on Kentucky cases? So we've been talking about this week and at the end of last, we are seeing this very serious escalation of cases in Kentucky. Just look at last week, 9,335 cases. Look at how quickly it grew and by how much. I'm here to tell you that we expect this week's cases to exceed last week's cases. I told you yesterday we had the single largest Monday in number of cases ever. Today, we have the single highest Tuesday with 1,786 new cases of COVID-19. That is 1,786 Kentuckians and their families that are worried about their health right now. And that's 1,786 Kentuckians, that some portion of which will end up in the hospital, will end up in the ICU, and will end up not making it. It is our duty as Americans, as Kentuckians, as good people of values and faith to come together once again to fight this virus. None of us a year from now, when we are in an old normal, a new normal, when we are beyond COVID, because I think we most certainly will be, want to look back and say, if we just cared a little bit more, what could have been. We continue to see increases in our hospitalization, with 913 Kentuckians currently in a hospital bed because of COVID. We have 233 Kentuckians in the ICU fighting for their lives, and 115 Kentuckians currently on a ventilator. Those numbers aren't going the right direction, but as long as cases are increasing at the rate they are, they're going to continue to increase as well. COVID positivity rate 5.97% today, the highest certainly in a long time. New cases by county. It's going to take a bit for me to read all of those in double digits, because when we have this many cases, it means we are having escalations in just about every county. Jefferson, 379 new cases. Fayette, 118. Warren, 68. Kenton, 60. Hardin, 49. Pike, 45. Barron, Laurel, and Madison, 42. Boone, 41. Bullitt, 40. Campbell and Nelson, 36. Clay and LaRue, 24. Hart, 23. Davis, 22. Lee, 21. Callaway and Logan, both with 20. Floyd, 19. 18 for Christian and Whitley. 16 for Jessamine, Johnson, Knox, Marion, and McCracken. 14 for Garrett, Henderson, Montgomery, and Todd. 13 for Clark, Hancock, Martin, and Rockcastle. 12 for Boyd, Grant, Perry, Shelby. 11 for Estill, Lincoln, Monroe, Scott. And 10 for Carter, Franklin, Graves, and Ohio. That list is far longer than any one we want to read. Again, that says we all have a lot of work to do. And if I read the name of your community, and your community is going red or going to be red, and we'll talk about this Thursday as the date that we look at that map, then you got a job to do, just like I do. And that job is to do what it takes to defeat COVID-19, to cut down on your contacts, to spend that next week differently, knowing that it has gotten dangerous enough to where for that period of time we need to alter our day-to-day lives to make sure we can protect those around us. And if you want to know the seriousness of it, which you would think that 1,786 cases, 913 people in the hospital, and 233 in the ICU because of COVID was enough, we have 18 additional deaths today. And every single one of these deaths occurred in October. We have a 99-year-old woman from Christian, which we lost, a 79-year-old man from Henderson, a 79-year-old woman from Henderson, a 70-year-old woman from Hopkins, an 86-year-old woman and a 62-year-old man from Jefferson, an 82-year-old woman and a 93-year-old man from Jefferson, a 62 and a 70-year-old man from Jefferson, a 79-year-old female from Jefferson, an 87-year-old male from Jefferson. A hard day for Jefferson County. We have two 96-year-old men from Jessamine County, a 76-year-old man from Nicholas County, a 72-year-old man from Ohio County, 91-year-old woman from Scott County, 77-year-old woman from Scott County, and a 72-year-old woman from Taylor County. 18 additional Kentuckians. And you can see the numbers that we lose pick up as our cases pick up. And sadly, I think we will see these numbers grow even higher. So we got work to do. But let's also remember that it's our job to honor those that we've lost and to support their families. So if you haven't been lighting your home up green, why don't we start doing it again? If we haven't been ringing bells at 10 a.m. in the morning, why don't we do it again? Because you never know who's out there and who it might help on that given day. We have more COVID now than ever before, and we need more support for those that are going through hard times or those who have lost than ever before. This week could be even worse than last week. So we need your help. Long-term care facilities continue to get hit. When we have so much virus, a community is red, it's going to get in that facility, even with everything we do. So protecting the most vulnerable is also about lowering cases in our community. So 57 new residents and 33 new staff members that are positive, 8 new deaths attributable to long-term care residents. The number of facilities is the same. Daycare, 10 new facilities with at least one positive case, 8 new staff, and 10 new children. So I read 18 ages and genders and counties of people we'd lost. But remember, these are people. They're people. And by now, you either know one of them or you know someone who has lost somebody. So today we're remembering Bobby Rohrer. On October 16th, Kentucky lost another veteran to COVID-19. Bobby, a World War II veteran, husband, stepdad, father, and grandfather, passed away after battling the virus for several weeks. Bobby was a hero to our people, joining the Army at just 16 years old after the bombing of Pearl Harbor. Bobby traveled the world, serving 3 years as an equipment operator with the 871st Airborne Engineers. Bobby never met a stranger. He loved getting out, meeting new people, and sharing stories. So much so that after retiring from a long career in government and volunteerism, Bobby could often be found at Walmart daily, where he'd just sit and talk to people. They even offered him a greeter position. Bobby was a father and a stepfather to 2 sons, 2 daughters, and a grandfather to 9 grandchildren who will miss him so much. And most of all, he'll be missed by his wife, Dana, whose name he called during the final days. Bobby was one of the residents of Thompson Hood Veterans Center in Wilmore, where he passed away, separated from his family. Because that's what this virus does to our people. Makes the hardest moments even more unbearable. Thank you to Bobby's stepson, Ken, for sharing his story. Ken, we are praying for you and your entire family. And we will remember the sacrifice that you had to make and how we lost your stepdad. But we will also remember that challenge in World War II that he faced called on us as Americans to sacrifice a heck of a lot more than the small things that if we did right now, we would better protect those around us, including your stepdad, who we have lost. So today, I wear my mask for Bobby and for his family. We love you all. We care about you. We are here for you, even if we have to be separated a little bit. All right, want to go over our Red County recommendations again and talk about how the timing works. And then we're going to have Kelly Alexander, who's our Chief of Staff for the Department for Public Health, share a very personal story that she's going through right now, and then we'll have an update on our prisons here in Kentucky. So yesterday we announced our red zone reduction recommendations. These are when a community, the spread gets so significant that it is really dangerous. It's dangerous to individuals. These are recommendations on how you can protect yourself. But they are also the steps that a community can take above and beyond the restrictions we have in place to get the levels of the virus down. Now here's how this works. It works the same as schools. So if you could show the incident rate map. We update the incident rate map every day, and that shows what counties are red, what counties are orange, what counties are yellow, and what counties are not green. Because currently we have 0 green counties, and this has got to be one of the lowest number of yellow counties we've had. It shows where the virus is. So what we ask our schools to do is that on Thursday, when the new map comes out, you check it. And that's when the guidance kicks in about whether you go virtual, whether you go hybrid, or whether it's safe to have a larger number of kids in school. And schools, following that guidance, are sacrificing for their community. High community transmission, they're moving to virtual learning so that that community spread doesn't also spread in the school. Well, schools shouldn't be the only ones who are taking these steps. And that's why we put out our red zone reduction recommendations. The goal of it is to have the community also doing all the steps that it takes to get that county out of red and back to orange and back to yellow. And these responses, if you can go back to the recommendations, are to be coordinated in the same timing of the schools. So what that means is on Thursday, we want our counties, our cities, our businesses in that, our state government operations in that area to be looking at the map. And if they are red, that gives them the next couple days to plan for what Monday looks like. For employers in a red county, again, that at the end of Thursday is red, we want them to have as many employees work from home as possible. We want our government offices in that area to be working virtually unless they provide a service that must be done in person. We're asking people not to go out in-person shopping and to order takeout, and if they need to do it, to prioritize businesses that enforce the mask mandate. We're asking communities to reschedule, postpone, or cancel public events, no gatherings of any type, and basically anything you don't need to do, stay at home as much as possible. Now, when you coordinate these two responses, the school and the community together, we believe that we can get the maximum amount of reduction by reducing contacts by the most that we can, reducing all the school contacts, reducing the work contacts, and those others that can be out there. We believe that if the response is coordinated in this way, we can get the best result. And it's designed to lessen the burden on our families. If a child is moving to virtual learning at home for a coming week, if a parent can also work from home, it is going to be easier on that family. And if that child is going to be home more, encouraging the family to be home more during that period, again, should also help that family overall. It's by putting this and the long-term care guidance that works the same way all together that we want to provide a structure for an effective response that we hope can get you out of the red and back to the yellow or maybe even the green as quickly as possible. And it puts the true power to do that in the hands of the community. If schools are going to do their part, government should be doing their part, our employers should be doing their part. It brings all of it together in a way to where we can have the most effective response. And if we can do this, it's just asking everybody to be as flexible as our students are, but it also lets us know week to week how safe it is or is not in our community. And at a time when we are increasing the way we are, we believe that this is the most surgical way to reduce widespread community transmission in our specific localities. So I'm happy to answer a few more questions about that later. But again, I want to point out that it's not just about reducing numbers. This thing is really real, and the impact that can have on families and couples is significant. So I'm going to ask Kelly Alexander, who has worked every single day as the Chief of Staff for the Department for Public Health, has battled this virus along with all of us every single day. You haven't seen her in front of the camera, but she is working as hard as anybody out there with the epidemiologist, with our team, with the local health departments. And maybe that's why it's upsetting that this virus can get so personal, even though to those that are already sacrificing so much. So Kelly.
Thank you, Governor Beshear. I'm Kelly Alexander, the Chief of Staff of the Kentucky Department for Public Health. My husband, Josh, is a firefighter in Louisville. He turned 40 in September, is extremely healthy, and doesn't have any health conditions. But unfortunately, on September 29th, he was exposed to COVID-19 at work. He was notified of the possible exposure on the 30th and began quarantine. During the evening of October 8th, he developed a fever and a cough. His symptoms worsened, and he was tested at a local community testing site on the 10th. A few days later, he was informed of his positive result. Josh's condition continued to decline. His symptoms were unrelenting. He had a high fever, difficulty breathing, and a horrendous cough. On the 9th day, he had difficulty speaking. He suffered from violent coughing fits, and on day 12, October 20th, Josh was admitted to the hospital. Thankfully, he went to the hospital when he did because his admitting diagnosis was acute respiratory failure, pneumonia in both lungs, and liver inflammation. Again, Josh is 40 years old. Prior to COVID-19, he was extremely healthy, loved hiking and the outdoors. But now he couldn't even talk without being short of breath or suffering from a coughing attack. While in the hospital, Josh received steroids, antibiotics, and oxygen. Thankfully, Josh is now at home, but he is not out of the woods yet. He is still fighting pneumonia in both lungs. Due to work schedules, I was not exposed, but I've been away from home since early October, and I should be cleared to return home later this week. The coronavirus affects everyone differently, but one thing is certain. This is not something you want to spread to your loved ones, and this is not something you want to watch your loved ones suffer from. Unfortunately, as Governor Beshear and Dr. Stack have said, we are seeing an unprecedented rise in cases, hospitalizations, and ICU numbers. My husband was included in those hospitalization numbers last week until his release on Thursday. My mother-in-law, who is visiting, also caught the coronavirus, was hospitalized, and was released yesterday afternoon. But these are not just numbers. These are people. These are fathers, these are mothers, these are husbands, these are friends, family, and neighbors. I do not want to see one more positive case of COVID-19 in Kentucky. I do not want to see any more Kentuckians hospitalized with COVID-19 or in the ICU. We must come together and act with compassion for our families, friends, and communities. Please stay home if you are sick. Seek medical care when and if you need it. Stay physically distant from others who are not within your immediate household. Wear a mask and practice proper hand hygiene. Thank you, Governor Beshear, your entire team, Secretary Friedlander, and Dr. Stack for all of your support during this time.
Well, thank you, Kelly. I know it's not easy. All right, next we've got Michael Brown, who is going to give us an update on COVID-19 and our state correctional institutions.
Thank you, Governor. I always like to bring, unfortunately, when you give these updates, a little context. So let me show you where we were a month ago. If you can bring that first slide up of where we were on September 25th. All right, so in September 25th, roughly a month ago, we were at 900 inmate cases on 154 staff cases, and we had stayed flat for several weeks, much like the state, but the virus is very persistent. So if you flash forward to where we are today, the slide that was just up. So we've got this divided in two categories. Today, if you look to the right of the screen, we're at 1,164 inmate cases on 194 staff. That represents an increase of 263 on the inmate side and actually it was 40 on the staff side. And the reason is you see this as active cases. As we look at it today, right now we have a total of 263 active inmate cases, and we can explain where virtually every one of those is. And then unfortunately, it's in one location, and we've seen this before. Next slide, please. This is Little Sandy Correctional Facility, and I'll show you an aerial of it because that's going to be able to relate to how we're dealing with it. At that facility, we had a total of 262 cases, and you've just seen we have 263 active. Well, there's 262 right there. We have 10 staff cases, 5 of which are active. And like I say, we've seen this before. So if you show the aerial photograph, I'll explain how we are. This is an aerial of Little Sandy. And if it should remind you a little bit of what Green River was. And if there's any advantage we have of having it here versus some of our other facilities, we're in a position where we can physically, again, separate the inmates. You know, of course, we separate the staff out, but we separate the inmates into 4 categories. Those who are positive, those who are negative but exposed, those that are negative and haven't been exposed, and those that are in the vulnerable categories. And we've done this successfully at other institutions, which we will manage to keep it flat for such a long period of time. But again, the virus can come in from any sources. Sometimes it's a transfer, sometimes it's the staff, sometimes we actually don't know how it got in there. The good news there is, so far we've had no hospitalizations at Little Sandy, so we've got that under control. I want to point out one other thing that the Corrections Department is still doing. To date, we've made 148,000 plus masks to distribute without the system and through others in the civilian community. We've created 23,848 surgical gowns to be spread out when there was a PPE shortage. And we've created over 1,300 desk shields. And if you show that one slide, and this, every day I go in and I sit across from our governor, and he has one of those desk shields on his desk. I got one on my desk, and we now have another 1,302 spread out from other places. This is what you have to do to protect against this virus. Wear the mask, do anything you can, and even with that, we still see it slipping in despite our best efforts. Thank you, Governor.
All right, we'll open it up for questions. Start, Catherine. So the question is, how do I think that businesses and others will respond to the new recommendations for red zone counties based on our experience with schools? The vast majority of our school systems have done the right thing and have followed the guidance. And I will say our school systems are working really hard. And we have seen, for the most part, really responsible decisions, even if they are difficult. I expect the entire community to do the same, because if you got your school system doing it, surely we can do it too. It's about everybody having to pitch in when a community is in the red, and that school system not shouldering the burden of all of it. And I'd hope no community would say, we're not going to do it while the school system is. I think it creates not just a Team Kentucky, but you pick where it is. A Team Hart County, which is one of the reddest counties at the moment. But a chance for everybody to work together, and then they'll even be able to see the progress that's being made and recognize it. So an opportunity for a community to do it right. Now, we expect our businesses, if they're being smart about this, to also want to follow these guidelines, because if your community is red, this can spread through your business really fast, and it is out there spreading. So if you got employees that are coming into the office that can be working virtually, you got a risk right there of losing your workforce and a large portion of your workforce for a couple weeks if they become infected. I believe that this can be much more effective than just the restrictions that we currently have and just from what the school system is doing alone. And it provides a level of coordination where, again, we think that the impact can be fairly immediate and fairly significant. Nick?
I have one question that I've taken from some people, is in terms of the beginning of this virus to now, and at the very beginning we saw some really tough decisions. We saw restaurant capacity, we saw stores closed, schools recommended to close. But we're not seeing that right now. Obviously, we're now seeing you're taking kind of a more county by county approach, with counties being in red, that's certainly giving more power to the counties. Why are we doing that, and why are we not, making some of those really tough decisions like we saw at the beginning of this pandemic?
The question is about, mandates versus recommendations, asking counties to do things versus the rest. First, let's put up the restrictions that are currently in place. So you're right, we have made a lot of tough calls and we have made a lot of tough decisions, but they haven't gone away. They're still in effect. And we still get pushback from them. You look at us going into the winter with restaurant and bar capacity at where it is, and we are keeping that mandate into effect. You see the response to the mask mandate from a small group. Doesn't matter, we're keeping it in effect. We got those out there that don't want to enforce it. That's become pretty unpopular about having to enforce it. We're still asking people to do it. Gatherings, which there's been pushback on, we still have at one of the lowest areas in the country based on where it is right now. Arenas, football games, having capacity restrictions, and we made those decisions in the last 2 months. So we haven't stopped making tough calls when they should be statewide. But what we've also seen is if you don't have everybody on board, if everybody doesn't have some responsibility and a part of the job, what can happen? All those restrictions I just mentioned to you, which are significant and should be enough, we still have cases elevating. And that's because we've got some folks that aren't following them. What this does is it puts, I think, the right type of pressure on a community to come together, to do what it takes, to do extra things, but to also follow those mandates. And if increases continue, if communities can't get these under control, we're not ruling out additional steps.
Just to kind of button this up, I guess. Especially in terms of schools and universities, we're seeing such high numbers. What's keeping you from making a recommendation that schools should just go ahead and everybody switch to online and universities should go ahead? But what's keeping you from making that decision?
The question is on universities and schools and what's keeping me from making a virtual-only decision. Well, first for our universities, there are positives and negatives on both sides. The fact that you've got students primarily on one campus that are getting good services in the midst of this, our universities are working hard on that. We have more testing among that age group when they are at universities than when they are at home. You've got the community, which is a little tighter. It's not in a bubble. It's still somewhat out in the broader community. But there are some pluses on the containment side on our universities, and our numbers are going down from what we've seen. Schools right now are working really hard. They're actually, from what we've seen, even doing better than expected, and we knew that they would work hard. But community transmission gets so high that it's going to get in the schools unless we can lessen it on the community. But we don't see school spread driving the community spread. But if there's that community spread, it is going to happen in schools. So we're trying to be more surgical. We're trying to take the steps where they need to be taken the most, and also realizing that distance learning is hard on the child, on families, and that if we can get people in the classroom, we should. And what we've developed is a fluid approach where it's disruptive. All this is disruptive, but you can be in class 1 week and out the next, but at least we try to maximize your opportunities. How you doing, Tom? Good.
Up until recently, a week or so ago, Franklin County was a yellow county, then it went into orange. If it goes into red this Thursday, does this mean you will be making the state government virtual?
So if Franklin County goes red, we will take some additional steps, but we are still in the capital and around most of the Frankfurt offices at a very low percentage. Even as we allowed capacity to increase in other areas, we have tried to be very careful and encouraged even all of our cabinets, when somebody can work virtually, they do. We will certainly have more people work virtually if and when it goes into the red, to try to lead by that example. So absolutely. Daniel?
Yeah, so obviously election day is next Tuesday. We're seeing campaigns make their final push. Many times in some of these red counties where the recommendation is that you don't gather at all. How do you balance that for the people who are trying to get out the vote for the election?
Well, our recommendations will go into effect this Thursday to start on Monday. But we certainly believe that people should be following them in their areas right now because it keeps you safer. Obviously, it's part of First Amendment speech, and so if there are ways to do it virtually, and I believe all candidates are trying their best to reach people virtually, that's optimal. If it's going to be in person, I hope that the very strictest guidelines are followed, and if people can separate out and do multiple events with smaller groups of people, that's better too. Elections are important, but so is people's public health, and I hope that anyone hosting an event will be as careful as they can be. Debbie?
And Commissioner Quarles has reported a letter about receiving additional CARES money for meatpacking plants. We're familiar with that and reached a decision.
So I just got a letter from Commissioner Quarles today asking for at least a couple $1 million in CARES Act funding for meat processing. We are currently analyzing it, but given that I just saw it today, we don't have an answer. Now, we are going to put aside a significant amount of CARES Act money to repay at least part of the loan we've taken for unemployment insurance payments. And so every additional decision that we make to provide funds, whether it be to this or others, will be less money that we can apply to that unemployment insurance loan. And certainly Republican leadership from the Senate and the House have pushed for as much of those dollars to go to that as possible. So those will be kind of the balancing decisions we make as we finalize, and I hope it's by the end of next week we'll finalize at least the plan for where all those dollars go by December 31st, knowing that we may have to be fluid because we may need more testing dollars here or a few there. Catherine?
Reading whether or not that's safe, and should parents be rethinking whether or not to allow their kids to go trick-or-treating when mask compliance is not always where it should be?
So the question is on trick-or-treating, and are we rethinking our advice on that? I think we've given really specific advice. I think we need to continue to message it as much as we can, that you need to just trick-or-treat with your immediate family, that you can't hand out candy yourself at your house. You need to place it out separated. When you put it out, you need to sanitize your hands, and when you get home with the candy, you need to wipe it off with a sanitary wipe, and you need to avoid any type of other gathering activities around Halloween. I can tell you my kids are not going to trick-or-treat this year. They love it, but that's the decision we're going to make, because even with those guidelines in place, we just got out of quarantine. We don't want to go back in anytime soon, but that's what I'm going to be doing with my family. Speaking of that, I have a question about whether I'm aware of the Hill of Terror, and if anyone from the governor's office has been in contact with the attractions operator either prior to the attraction opening or since September 18th. So the Labor Cabinet is aware of complaints regarding Hill of Terror and are taking appropriate steps. This is operating in Hart County, a red county with one of the highest rates in the entire Commonwealth. So to be red, it takes 25 cases per 100,000 residents. Hart County is at 90.06. So a concern, and certainly I would encourage people, whether it's open or not, don't go right now. Several colleges and universities are located in red zone counties. With the new recommendations for red zone communities, do you think colleges and universities should move to online instruction and allow employees to work from home for a week? First of all, every employee that can work from home during that week should. I know the universities have their own plans. We've looked at them. We think they're pretty good for how they manage online and virtual. They've got a significant amount of testing around it. But when their community is in that red zone, we think they ought to take another hard look about what they do, certainly for that week. And there are a lot of other recommendations in that red zone that they ought to be following, including gatherings and events, public and private. Daniel?
Yeah,
Oh, I'm sorry. I didn't mean to. Yeah. All right, Tom.
This outbreak in in Elliott County, that cropped up in like less than a month.
The outbreak in Elliott County is in the prison we talked about today. But let me just point out, because I had a state official suggest that Elliott County shouldn't be making other changes or following recommendations because it's all in a prison that's locked down. That's not how it works. There's 300 plus employees, vendors, and the rest that go in and out on a daily basis. And with that amount of virus in the facility, people coming in are getting it, and people are taking it out. And it means that community is at risk based on that level of transmission. I want to do the right thing to protect that community, and I think local leadership does as well. Well, you can ask another one. Yeah.
So, I mean, because it jumped to 509 and current 100,000 people. So basically you're saying, no matter what, even if it's just in one isolated place, it needs to...
So this is a follow-up on that. This virus at its levels is never in one isolated place. What those places do is give us an idea of overall transmission. Now, it's going to be higher in that isolated place than in the rest, but people coming in and out of these facilities mean the risk for spread in that community is still greater than ever. And when we look at a practical standpoint, what would we end up with? Well, people would be arguing, well, that's just in a nursing home. Or early on we heard, well, that's just in that community over there in our county. When we turn red, we're asking people to do what it takes to tamp it down. And it's calculated by week of new cases. That's what that incident rate is. It's new cases on that 7 days. So those individuals who are in that prison, won't be counted in that next week when they roll off too.
Well, and so maybe, I'm not trying to go for the program, but skipping ahead to the next holiday, Thanksgiving, when are you going to start laying out your recommendations for Thanksgiving, or how people are supposed to gather in this really difficult time?
We're going to get through Halloween, and then we're going to have our guidance on Thanksgiving. But I'd do this. Thanksgiving needs to look very different, much smaller. You shouldn't have your older relatives over during that period of time unless you already have that regular interaction with them. Travel is something that you shouldn't do this year, and so we ought to go ahead and start preparing that. Now, that breaks all of our hearts. We love Thanksgiving, but Thanksgiving's a time that we're thankful for each other, and we got to make sure that it doesn't harm one another. And we got to come to terms with this is our COVID year, and nothing is going to be normal. And all of it is going to take sacrifice until the virus goes away.
What about college sports in counties that are red? Do you foresee limits on, say, attendance at football games at U of L or Western?
So on college sports in red counties, we think that the colleges need to take a close look. We do feel good about the percentages of attendance at those games, but our recommendation is if you are in a red county and you are the individual, that you are a lot safer not going to that athletic event than going. And again, we'd ask that our university presidents and our athletic directors take a close look at that incident rate, and make a good decision accordingly. But again, I want to point out that these red county reduction recommendations aren't just to the county, they're to the people of our Commonwealth. Because if you're frustrated about those around that aren't doing what it takes to stop the community spread of the virus, this gives you advice on how you as an individual can stay safe. I also missed yesterday. There was an amazing Kentuckian, many of us know him as Uncle Teddy, who turned 99. He headed the Kentucky State Police at one point, and Keeneland, and I missed the happy birthday wish for him yesterday, but wanted to make sure that I got it in today. Still beloved by this Commonwealth, and we appreciate you, and celebrating his 99th birthday in a COVID friendly way, not doing what otherwise would have happened is exactly what we need out of folks. All right, so we've got the plan. We've got the coordination. We have the recommendations for how communities in their own backyard can lessen the spread of this virus. So let's get out there. Let's do it. Let's stop this escalation. Most importantly, you now have the power to protect those who live directly around you. Let's make sure we use it. See everybody tomorrow at 4.